From NBC News, this is Today with Katie Couric and Matt Lauer.
And good morning. Welcome to Today on a Thursday morning. I'm Matt Lauer.
And I'm Katie Couric.
This morning on our continuing series, Forever Young, A Guide to Life After 50, how to pick a plastic surgeon. In 1996, almost 1 million cosmetic surgery procedures were performed. That's an increase of more than 50% over the past 5 years. Dr. Darrick Antell, a board-certified plastic surgeon in New York City, has a rundown of things you should know before having plastic surgery. Dr. Antell, good morning. Welcome back.
Good morning. Thank you.
This is a nip and tuck to some people, but let's remember, this is surgery, so the decision's important.
Absolutely. You can't forget that it's surgery and there are potential complications. That's why it's critical that you invest time to pick a surgeon properly. Some people spend more time picking a toaster oven than they do their surgeon.
So what do you do to get information about the different doctors who are available in your area?
Well, I get asked that question a lot because New York City is a mecca for this type of surgery. And I recommend that people start developing a list of potential candidates. See if the same names keep coming up more than once. Ask your personal physician. Ask your friends. I would ask hospital personnel, and most importantly, I would check that the doctor has privileges to do the operation you're interested in a hospital environment.
And that means that the doctor has been through some kind of peer review at that hospital, so you're getting a fairly qualified or a very qualified doctor.
Absolutely, because today many of these operations are done outside the hospital, and there's less peer review. So if the doctor has privileges to do it in a hospital environment, you can feel comfortable that he's undergone that peer review.
Two words we hear an awful lot about when talking about plastic surgery: board certified. How important?
Board certification is very important, but it's become kind of a buzzword. Consumers know it, but they don't really understand all the different boards. It's very confusing. What you want to look for is board certification in plastic surgery, and "in" is the key word.
So in other words, you're saying a doctor could be board certified in one area, but not in the area you need him or her to be.
Exactly. And today, unfortunately, in this era of commercialization of medicine, many people advertise, and they'll put board certified in the ad, but not indicate what specialty they're board certified in. So you want to check what specialty they're board certified in.
And an easy way to find out about board certification, we have a phone number we want to put up right now, and that's simply just call this number?
Yes, it's the American Board of Medical Specialties, and they are the only board recognized by the American Medical Association to certify people in over 24 medical specialties, one of which is plastic surgery.
What about when someone's having a procedure done, say, a nose surgery, but it's for more than cosmetic reasons? It's because they have polyps or breathing problems or sinus problems. Do you look for a different kind of doctor?
Well, you may. An ear, nose, and throat doctor would be board certified in otolaryngology, and that's what the board certification would come up as. What we do in my practice is if there's a problem with the breathing, I may work in conjunction with an ENT doctor where I'll do the external part for the cosmetic portion,
right,
and at the same operation they can correct the internal part.
So would you give someone a referral then for the other doctor as well?
Yes, absolutely.
And we have a phone number, by the way, for that also if you're looking for a referral on a surgeon. Different number than before, 1-800-635-0635. Now, once you've narrowed down the number of doctors in your area, you should go for a consultation. Very important. But what do you do at that consultation?
Well, during the consultation, I would start by looking at the office, make sure it's clean, friendly, make sure you have some rapport with the surgeon. I would ask about potential risks. I would ask if he does the surgery himself. Very important question.
Also, it's important to know how much time the doctor's willing to spend with you during that consultation. You don't want someone who's going to run in, look in, go, and then run out.
I would also ask about cost. I think cost needs to be gone over in great detail. And this is an area where it pays to pay retail.
You see on billboards and you see on television doctors who advertise that they use this computer system to show the patient what he or she might look like after the surgery. You, though, tell a patient to stand in front of a mirror and you actually use your hands. Why?
I do that for a couple of reasons. I believe it's more accurate. I think the computer's misleading. It doesn't account for swelling. But I also need to feel their skin. And by feeling the texture of their skin, if I'm going to be doing a facelift, it may modify the techniques that I'll use to get the best possible result.
So is the computer imaging a gimmick?
I believe that it's a gimmick. I think there's no way you can guarantee that result.
Quickly, what's the most typical side effect from plastic surgery that people should know about?
I would say that hematoma is one of the most common. It's a little collection of blood under the skin. In most cases, it's small and goes away on its own.
Dr. Darrick Antell, great information.
Thank you.
Appreciate it.